Hello and welcome to this interview. My name is Chisengo and I'm joined by our former student at Texila American University. This is Mr. Featherstone Mangunje, and he's going to introduce himself. He's going to tell us about what he learned at the institution, the program that he learned, the position that he has, and which organization he's working for.
Yeah, so thank you, Chisengo. So my name is Featherstone Mangunje. I'm the technical advisor for policy and programs here at FHI 360, which is Family Health International, on the project called Mosaic. So this particular project is there to advance or promote new introduction of HIV biomedical methods. These are PrEP methods that come on the market. So as they come on the market, then we offer support to the ministry to make sure that everything goes on well.
So we have an idea of where you're working and what you studied. So you did a master's in public health at Texila American University. And looking at your new role as a technical advisor for policy and programs here at FHI 360, which is not well known as Family Health International, how do you plan to leverage that knowledge that you've obtained through masters in public health to help in implementing programs that help in adolescent health?
Yeah, so really the knowledge that I obtained from Texila American University, very valid and very solid, and I think this has given me quite a lot of confidence in terms of I think really informing the programs and the work that I do. And so we are supporting the Ministry of Health, in particular the public health unit, as it were. And so this just knits very, very well in terms of what I learned from Texila, and then going on ground now to implement some of the insights and skills that I got from there. So in supporting the adolescents, adolescents are very interesting, population with very interesting challenges around them, and so they face a lot of, I think, public health issues. And so those skills that I bring on board, I think really they have been quite amazing in trying to offer support to the ministry.
All right, that's interesting. Meaning that you have tailored interventions specifically for adolescents as well.
Yes. So remember my previous role, I used to be senior technical officer for adolescent health. And so one of the units that we offer support to the ministry is the adolescent unit, which I think deals around sexual reproductive health rights for the adolescents, and also for the HIV, part of it, within amongst the adolescents. So really, I think that is what we support. We offer support to the ministry. Yeah.
Okay, that's good to know. And looking at all that you've shared with us, it just shows that data-driven decision-making skills are the cornerstone of public health. How do you plan to make strategies or programs that help the adolescents and their health?
Yeah, very, very good question. So evidence-based, I think practice is what is acknowledged worldwide. It's a standard in itself. And so in terms of, I think, us offering support to the ministry, our project is a global project, and we are about in 11 countries, and in those 11 countries we do almost similar things that we're doing here in Zambia. And one of the pillars or one of the result areas which actually is amongst in our project is research and research utilization. So meaning you go and conduct research, you collect data, but you don't just collect data, you use that data to inform policy. And so exactly this aligns now with my current position and role of advising the ministry on policy and programs, evidence-based, data to policy. Yeah, so it sits very, very well, and this is because of the knowledge that I gained, or the skills I gained from Texila American University.
That's interesting to know. At least we know that Texila American University has been impactful even in these organizations.
Yeah.
So looking back to what you said, you're a technical advisor and you offer technical assistance to the ministry. I can see that the collaboration and networking skills really come in handy in this set of work. How do you, from the information that you've gained from Masters of Public Health, how do you strategize in creating these partnerships with these organizations?
Yeah, so it is important always to work with various stakeholders, because I think working in silos is not always encouraged. And so, one of the skills that I brought on board on this project was the moment I think the project was launched, I had to do what we are calling stakeholder mapping. Okay, who is doing what in this particular space? So be it from the private sector, from the implementing partners, within government, from the community. And so that in itself, I think, informed our decisions to say this particular organization is doing this piece, so that we don't reinvent the wheel. Yeah, so we work with various stakeholders, and in this particular project, yes, on the other side we work with the Ministry of Health. On the other side, we work with what we call civil society organizations. These represent the people. And so stakeholder, I think, engagement, having all the stakeholders on the table is something that I think one of the skills I learned that you need to bring and not leave anyone behind, but move as a unit.
That's good to know. So when we talk about collaboration and networking, it will not be effective if you don't have proper communication skills. So from what you learned at Texila American University, how has it come and how was it being helpful knowing and learning the communication skills?
Wonderful. Interestingly, within a very short space of time, we have really improved on our networking around with our organizations. And this is because I think people are able to connect with us because we've been very clear in terms of what our vision is, in terms of what our work is. And so we have established various platforms where we can really define or present our scope of work. And some of these platforms is what are called the technical working groups. There is one for the adolescents, there is one for the HIV, there is one for the family planning, and several of them, just to mention just but a few. So in these particular platforms, we have used them really to communicate what our core values are, what our vision is. And in doing so, it just doesn't just come like that. It comes with skills. And these skills are not just from without. Most of the skills I'm utilizing in this particular sense, I learned them from Texila University during my Masters in Public Health program.
As much as it would be lovely to be here and ask you these questions, lastly, with your new role as a technical advisor, how are you being effective not only to the work itself, but also in the institution, which is FHI 360, how are you bringing into play certain things that you learned so that they can help even in the programs that you are making here?
Awesome. Yeah, so, to be a technical advisor on policy and programs is very, very crucial because my role is to support my project director. And so this office here where you see, we call it a country office because we have other projects that are operating outside this building. And so really the skills that I come with, which I carry to FHI 360 is teamwork, very important to make sure that I think I'm part of the team. Innovation, okay, so thinking outside the box, very, very crucial. Communication that we have already talked about in terms of really articulating clearly our objectives and our vision. And then also, I think it is very, very important what we call unity in diversity. Okay, this, I think we uphold it as an organization where we really treat each and every person very, very important, regardless of their position within the organization.
Thank you very much, Mr. Mangunje, for joining us for this interview. And you've heard it from our former student, our very own product of Texila American University, showing us the importance of having a master's in public health paper from us, or even a bachelor's in public health. Thank you.